eventual action. All of the factors that I've just described coalesced with the two tobacco policies that I mentioned. We had two committed ministers who emerged and expressed interest in advancing tobacco control. Advocates were very skillful in framing their public arguments by publicising research on how the tobacco industry salivates about the youth market and about how retail displays and packaging are the new front lines in tobacco marketing. This forged a critical opposition between the proposed legislation and widespread public contempt for modern-day corporate Pied Pipers like the tobacco industry. Analogies with the way that prescribed drugs, which actually save lives and relieve pain and do all sorts of useful things like that, are not put on open display in shops, as with cigarettes, help to as cigarettes are displayed, I should say, help to denormalise the idea that it was normal or natural to display cigarettes. This sort of rhetoric and analogy was picked up by health ministers and was first used in research papers. The same rhetoric is now being used to frame generic plain packaging of tobacco products as the next big thing in tobacco control. And we're all hoping in Australia that we beat Canada to that particular race. It's one of the most important things that I think can happen in tobacco control policy. Tricia Greenhull has emphasised the importance of understanding the role of rhetoric and dramatic dialogue in the way that research is presented to and then applied by policymakers. Bob Carr, the Premier that I interviewed, spoke of killer facts that are hard to avoid. If there is a single most important lesson that I've learned in 30 years of advocacy, it's this: politics is largely about the problem of multiple definitions of the same events. The art and science of effective advocacy is then all about the challenge of defining health problems in ways that makes their solution politically compelling. The role of research here becomes one of moving from a very apolitical, curiosity-driven research designed perhaps to impress a handful of colleagues interested in some arcane theory or statistical application, to strategic policy-nurturing research capable of leveraging policy. Now, over 17 years of editing, I've identified a variety of such papers. These include what I call case-making papers. These could be from epidemiology, looking at causal pathways, mortality, morbidity, human and economic costs, also evidence about the public support for actions. Another category I call "We're all doing well" or "We need to catch up" papers. These are sort of international or national comparisons with potential to embarrass governments. Governments in Australia at the state level are very keen not to fall behind the other states in what they do. So there's a lot of comparative work done. Third ones are agenda-setting papers. Here I mean new breakthroughs, innovation and imaginative new policies which capture the imagination of progressive politicians wanting to break new ground. Plain packaging, I think, is one such example. Next one are what I call do more of papers. Evaluation research papers that support present policy and practice, making policymakers look good, applauding the fact that they've taken decisions in the past which have allowed programs to take place which are starting to, to do well. And the obverse of that is the next one: do less of, stop altogether, or what we can call Emperor's New Clothes papers. These are papers particularly if studying things where reversal of policies of previous governments are called for, or where lots of money could be saved. Next one are law of unintended effects papers. These are sort of surprise bonuses that add extra support to taking action. When we discovered that banning smoking in public places actually had a profound effect on reducing daily smoking frequency amongst continuing smokers, that was very big news. It turned a lot of heads. The next one are what I call turning myths on their head papers. These are new ways of seeing that freshen interest in phenomena which may have gone stale. Always need to sort of take the temperature of how the community and particular reference groups are thinking about potential policy changes. Finally, opposition discrediting papers. This is research that reveals heinous vested interests, values and conduct of those who stand in the way of policy reform, such as the tobacco or fast food injuries or the anti-immunisation lobby or groups like that. Personal contact with policymakers, the ultimate pathway to influence, does not happen by magic. It mostly happens when politicians have encountered you in the media, like what you had to say, and decide to bring you into a kind of charmed circle of influence. Like all of us, politicians like to surround themselves with pleasant people who share their values, don't assail them for their failings, and who they trust to give expert and considered and timely advice and support them on matters in which they themselves are inexpert. Policy researchers have described this as social solutions to research dissemination, which involves a networking of research workers with these policy influentials. No, don't die waiting to be contacted by policymakers, but instead, in the words of Mae West, remember that it's better to be looked over than overlooked. Many researchers are unfortunately very shy, introverted creatures. They regard the prospect of actively promoting their research findings in the media as unseemly, preferring the quiet and mannered discourse of the academy. Equally, many research institutions also give very low priority to the active, creative promotion of research and to the advocacy of policy. Research granting agencies need to put far greater weight, I think, into requirements for researchers to provide plans about how their research will climb out of the comfort zone of the cosseted covers of often obscure specialised journals. The greatest achievements in health and medical research are those where the research starts fires in the world of policy reform. Thank you very much for your time today.